Welcome to the School for Healthcare Entrepreneurs, the only podcast that provides actionable insights into the healthcare industry. Brought to you by Emitrr, the leading communication platform for your healthcare business.
Hello, everyone. Welcome to another episode of the School for Healthcare Entrepreneurs. I'm super excited to bring you another guest who brings with him, a vast experience in the healthcare industry. I have along with me David Paul Cavazos. He's the CEO of Hodgeman County Health Center. My name is Anmol and I'm your host. And I'm excited to bring to you a discussion between me and David Paul to talk, what's happening in the healthcare world, what are the changes, and what we see as the future of healthcare and technology. Thanks a lot, David, for agreeing to be part of the podcast.
Thank you, Anmol, for having me on. As you said, my name is David Paul. I've been in healthcare for about 26 years now, and spent the first 17 of it on the radiology side, and a number of years back moved up to the executive side. But it's been a long run.
Great. No, that's definitely something that got us excited, right? Because we believe that there's a lot that you can let our audience know about, the overall healthcare ecosystem, what technology can bring. So would love to, I would say if we could start by learning a little more about you, your background, and, that'll maybe set the context for the audience, and then we can, jump into specifics.
Right. So I started back in the mid to late 90s, and I started with my experience as a radiology tech. I was a young man and trying to figure out what I wanted to do, and so I ended up going to getting steered in the direction of radiology school to become an X-ray tech. And so I pursued that, worked at large hospitals, had an amazing time. It was a great time in my life, but kind of as you do when you're a young man, you meet somebody, you get married, and then your expenses become greater. So I had to look for, I had to look at higher things. So I started to kind of pursuing the path. You climb the ladder, in your career, supervisor, manager, radiology director, so on. Became a radiology director of a department, and I had a CEO pull me aside one time, and he asked me, he said, have you ever considered being an executive? And at the time I said, no, not really. That's radiology director was as high as I had ever thought. But that short little conversation he had with me really changed my life. It set me on the course of a new path. I went home, talked to my wife about it, started looking around for schools for MBA and finishing out my bachelor's degree. So we started on that path, ended up going to school for an MBA with an emphasis in hospital administration. And then, you begin the process of looking for that first job out of school as a CEO. So.
Great. No, I completely agree with you. And interestingly, I tell a lot of my friends or team members who are much younger than me that, like you said, right, when you're young, you can start out, but when responsibilities grow, that's when you'll realize the need for the change, right? So I always tell them you'll realize when you reach my age, right? All that.
Yeah.
But yeah, great. But yeah, 17 years. And were you a radiologist were you in the radiology space for 17 years? That's when you realized this and,
Yes, actually, yes, I was. So being a radiology tech and moving up through the departments, it was such a great experience. You got a ton of patient interaction. Radiology is just, it's what they call one of the ancillary services, like lab or X-ray, or that's what it is. But within radiology, you have so many different fields. They refer to them as modalities. There's MRI, CT, ultrasound, all these different areas you can pursue, right? So it always keeps things very interesting. And sometimes you just come upon an opportunity to maybe become a supervisor or something of that nature once you've been in long enough, and you take that, and then you just get the inspiration to go for manager and the director. And I think a lot of younger people and even older people don't really understand how one moment in your life can have a great effect on somebody. Just a few words in the right direction, encouraging somebody, can really change their life and give them the little push that they needed to go down a different path.
Absolutely. And I think that's definitely very true in your case, right? That even 17 years later, you're ready to go back to school. You're ready to go back and, unlearn a lot of things that you had learned and restart with a completely different role, right? So tell us a little bit about that. How was that experience going back to school 17 years, after having worked?
Gosh, yeah, it was scary to say the least. It really, it should have been, because these days tons of older adults go back to school. But it's a commitment. It's a change in your life. And if you're married, then it's a joint commitment. The family commits to giving you up for some time. My schedule was I would go to work, get off work at 4. I would then head to the place where I was going to school. I would head to school, and I would have class would end at about 9 or 9:30 at night. I would turn around and I would drive back home, and I would study till 2, and I would force myself to shut it off at 2, sleep for a few hours, get up by 6, and do it all over again. That was my regular path for 3 years. And so it was life changing. And my wife, gosh, she was a trooper. I really owe her a lot. She really held it together during that time. So it's a family commitment indeed.
Absolutely. No, absolutely. I mean, in anything, finding the right partner is the biggest decision, is the most important decision, right? Whether, it's personally, whether it's professionally, it's important. So, I'm glad that you had the right support, and today you are where you are, being able to make the contributions to the healthcare ecosystem, right? Great. So, you spent about 3 years in school after having worked for 17 years. I understand, of course, it was a completely new experience, and you had to manage both work as well as school. But how was the overall experience? Did you have a lot of people at that time as well, who were coming to school with a lot of work experience, or was it, people with a younger, I would say, in the younger cohort who were going to school at that?
It was interesting. So when I went to radiology school initially, I had just pursued an associate's degree in radiology. And so when I met my wife, that's what I had. I actually had to go back to school to get my bachelor's first. And in that, at that level of schooling, I was really an older adult in a classroom full of much younger people. But, it all works out in the end. And then going back for my MBA for graduate school, at that level, I really encountered a lot of adults my own age and just kind of doing the same things, working during the day, going to school at night. And it was great interacting with them. It's inspiring to hear some of the other stories and just the extent that people are willing to go to improve themselves. It really pushes you forward and really inspires you to go forward.
Absolutely. And that's exactly why, I was asking you that, were there people just like you? Because if you have like-minded people, it keeps you going, right? Because there are others also who are managing both the sides, the work as well as, studying and pushing hard to take a big step in their career, right? Got it. Great. Now, you've interestingly seen, both the clinical side of things, the ancillary side of things, and now you are now you're experiencing what it takes to be to run a business, right? And you're spearheading that entire business, right? Of course, you've experienced clinical side, ancillary side of things, hands-on. You've experienced business side, hand-on, and now you're spearheading it as well, right? Having seen, all of these different, I would say, aspects of healthcare, both hands-on, leading it, with a team, what would be some of the challenges that you think the healthcare industry is facing today, which didn't exist previously, and what would you think were some challenges that now have overcome, maybe with the help of technology?
All right. So, interestingly enough, that there's essentially two main core challenges in healthcare these days. One of them has been around forever, and that's cost. Right? Cost is a massive challenge. With the way inflation and things have gone up in the nation recently in the last several years, they affect us in our home with everything from buying gas to buying a gallon of milk, right? Well, it's no different in the business world, and particularly in healthcare. The cost for healthcare supplies, procedures, it's all gone up. Cost for labor's gone up. And that touches on the other point, and that is the healthcare workforce itself, right? In the old days, there was always a need for more physicians, right? That's just a common theme in healthcare. Oh, we need more doctors. That's whether you're in the city, whether you're in the rural area, you need more doctors.
Right.
After COVID, and even during COVID, that really had such an effect on changing healthcare in the nation. It's not just physicians that we need more of anymore. It's workers across the board. It's workers in the business and coding office. It's workers, in the ancillary fields, workers in the nursing field, especially, everything that it takes to run a hospital or even a clinic, we need workers, healthcare workers across the board in all job descriptions. Yeah. So those are the two main things, healthcare workforce and rising costs that it takes to deliver the same healthcare from 5 years ago. So.
Got it. And I'll talk a little bit, I'd love to know a little bit about the rising costs. Of course, that's a, I would say constant challenge, right? And I think it'll continue to rise, right? I mean, interestingly, every time I would, speak to my family and I, there are different perspectives, right? People have, should you save a lot? Should you not save? And interestingly, in my family, there's always the thought, right, that you've got to save because the cost of healthcare is going to keep going up, not for any other reason, right? So if you need good healthcare, you got to keep saving, right? Yes. But would love to learn from you that why do you think this challenge, and it's become even more acute recently, right? So we work with 1,000+ healthcare practices, and I've never heard any of these healthcare practices not bring up this challenge of talent and of building a team, right? So just trying to understand from you, what's the reason from your experience that you think there is a shortage in nursing staff and staff overall in the healthcare world?
So I don't think really, as we entered the pandemic, as the pandemic begun, everything was centered around the shock of it initially, right? COVID in its early months was a really nasty disease, and it was having a damaging effect across the country. Not only was it damaging in terms of people's physical health and how many people we were losing, but it was scaring people. The nation was in panic, right? So typically most of your ancillary or nursing programs have roughly about a 2-year turnaround time. If you're a young adult and you enroll in a nursing program or a radiology or lab or something like that program, you start, and in about 2 years, or sometimes, a year and a half or whatever the term is, you should be getting out. Mm-hmm. Well, COVID basically lasted 2 years. So when the nation first got COVID, everything shut down. People quit meeting. People went to a Zoom format, if that at all, right? People weren't meeting in groups anymore. Classes that were normally being filled were empty. Schools were some schools were closing. So now what we basically have is a 2-year cycle gap. So now COVID's on its downturn, and what we're seeing is the flood of people getting out of school that we should have, we're not having. Mm-hmm. The numbers are really decimated. They're much lower than they should be for young kids, young adults coming into the workforce. Mm-hmm. And the young adults that were in that 2-year period that would have been during those years getting out of high school, figuring out what career field they wanted to go to, is before, where healthcare might have seemed like a very interesting and appealing career. Now, I don't want to say healthcare has an ugly stain on it, because that's really not it. But if you look at those first few months or even half a year when COVID was here, what we saw in the news media, kind of what was going on in New York, that would have scared people from entering. Would you want to be a respiratory therapist after seeing how many people were passing away and how quick they were dying from COVID? That scares people to say, I don't want to go into that. I'd rather do IT or I don't know, write in a newspaper or something else, right? Any other field but that. And I feel like we as a nation need to get back to reinvigorating our youth into the benefits of working in healthcare. Mm-hmm. It has always been and still is an incredibly rewarding field to work in. There is a lot of good to do in healthcare. I originally started pursuing healthcare. I was just a waiter. And I was a young man. I didn't know what I wanted to do with my life. I just knew that I wanted to make a difference in people's days. Right. I knew that I wanted to mean something at the end of my workday to somebody out there, and I didn't even know how to start that. So I looked at healthcare, and then it became a lifelong career and just really a love. So I think we need to kind of give our young folks an injection of the benefits of helping other people. Helping the people around you. There's a lot of fulfillment to be had in that. And you can spend a whole career in it, and you can really find your place in life in healthcare.
Absolutely, absolutely. So if I'm hearing this correctly, it might have been a challenge prior to COVID, but it's grown exponentially after COVID because of the fear of COVID and what people maybe mistook of the healthcare world after seeing the impacts of COVID. That's essentially what's causing this problem to occur.
Absolutely. In all industries, they go through downturns and shortages in workforces. You have, as I understand it, I think the blue collar working industry is also in a shortage of workers. There's a shortage of plumbers and HVAC workers and all these things, but they've really done a good job of coming together and announcing that shortage, making an awareness of it, and trying to bring awareness to the fact that, hey, we need more young people to go into this field if you want manufacturers in 5 years, or you won't have enough manufacturers, right?
Right.
And I think we in healthcare have missed the mark on that. I don't think we've done enough to interest the young people that are out there today in the benefits of a career in healthcare. The military does it, right? They go through stints where they need more people, and so they'll offer incentives, they'll offer this, they'll do that to try and attract attention. And I think we as an industry need to go after our young people with an enthusiasm to show them what a good career this is.
Right. Got it. Interesting. Yeah, hopefully, once everything comes back to normal, of course, everything is back to normal, but hopefully when, I think as humans, we tend to forget things quickly, right? So hopefully when people forget the impacts of COVID and with the progress of healthcare industry at large, things should come back to normal. So I think that's the first reason which I think requires a lot of education, right? We need to educate people. But what about the second challenge that you highlighted, right? Which is the rising costs. Of course, everything is tied to the cost of the fuel. If the fuel price goes up, everything goes up, right? You're bringing everything with the help of fuel. But why do you think, or more than why, would love to understand the costs are going up? Is it also because there's a lot of dependency on human, there's a lot of manual work, or do you think there is some automation that could be brought in to sort of reduce costs and reduce this dependency on staffing, if not completely, but at least to overcome in the short term?
Right. It's funny how many outside factors affect us that we just never thought about before. Previously, 4 or 5 years ago as a CEO, I never would have taken into account whether or not there was a strike or a shortage of supplies on the West Coast with containers coming in, whether or not that would even mean that I would be short on gloves in the next 5 months, right? Yeah. And nowadays I watch and I pay attention to that kind of stuff. Is there an issue with the railroad? How high are fuel costs going to go? Because in 8-9 months, I will see the effects of whether or not the current warehouses that are stocked with medical supplies, are they falling short? Yeah. And of course, whenever there's an increase in the shortage, the costs go up of goods, right? So that was something we saw. That was a lesson. I learned that lesson hard in COVID. Start paying attention to what's going on now, and you'll see the effects of it in about 4 or 5 months in terms of materials. Right. Now, how does that affect us with workers? I do think that at the crossroads of healthcare and technology sits entrepreneurship. Mm-hmm. Yeah, we in healthcare are, I don't want to say stuck in a mindset, but we're used to doing what we do on a daily basis. Entrepreneurs bring an enthusiasm for a new way of looking at things that we maybe didn't realize could even be, that we could even overcome that hurdle before. Mm-hmm. There's one of the things that there's a shortage of is, let's say, billers and coders, right? Mm-hmm. There's a great shortage of billers and coders. And while I need more people to choose that as a career, so that way we can have more billers and coders in the industry, maybe a way to create an efficiency there is through technology. Technology, based around creating automations in certain areas. AI is huge right now in creating automation and efficiencies. And I think with the enthusiasm that entrepreneurs bring for looking at something in a different way than I ever did before, that's really where people come to healthcare and they say, you know what, I've created a new way to do this. I heard my uncle, he works for a hospital, and they couldn't get anybody into this position filled. So I created a software for them. And now the job duty is completely different. And that's something we never would have figured before COVID. Yeah.
Right. Got it. Got it. Interesting. So I think if we can bring in more and more, people with the entrepreneurial mindset into the healthcare world, let them experience it and see, maybe they'll bring in a different dimension and a completely fresh perspective, right, to solve these problems. Got it.
Yeah, I think so. I think for too long, the industry as a whole has had a closed mindset.
Mm-hmm.
Not necessarily to technology, but just to the idea that, well, we know what we're doing. Sure, we do know what we're doing, but perhaps there is a more efficient way to do what we do, right?
Right.
Most times efficiency means better. Not always, not always does it equal better, but usually it does. Usually creating efficiency means that we can streamline things, lower our costs, and offer a better service, a better way to do healthcare. So.
Right. Got it. No, that's definitely true. And, a lot of, I would say a lot of healthcare CEOs that we've hosted on this podcast have, as a matter of fact, said something very similar, right? Now, maybe they did not say that bring in an entrepreneur to solve this problem, or maybe bring in somebody who understands technology. But a lot of times they've said that, there are great leaders outside of healthcare world in the other industries. Why should they not come and pursue leadership roles in the healthcare world, right? And maybe they need to understand that there is a lot more work to be done. There's a lot more, scope to grow in there. And that's one thing that we should bring it out.
Absolutely, because one thing that I don't ever think will change as an industry is at the heart of your healthcare industry is your people.
Mm-hmm. Right.
People across the board, whether it's, I had the misconception as a young man growing up, or even as a child, that the only two people in the healthcare industry were doctors and nurses. And there's so many more people that make the wheel turn in healthcare. And people is what's at your core. So if you have a CEO in another industry that just does an amazing job with, creating change, improving innovation, or even inspiring workers, just mentoring those people below them, I think if you had a hospital, a health system, a clinic, I would definitely be willing to listen to the way that he's doing things, because there might be some good notes to take from that other industry.
Absolutely. Yeah, I think that's something that will change, right, with time, and people will start to realize. As a matter of fact, I clearly remember, I think one of the biggest dental DSOs, right, CEO comes from a consulting background. Now, he's a great fit there because he was consulting DSOs, right? So he was looking at it from an outside lens, how they can improve things, how dental practices can become better and better. And ultimately, he sort of came in to run the DSO with about 500 plus practices, right? So hopefully that change will happen, and we'll have more and more minds coming in and, making a push. Great. Another interesting thing that, sort of, since we're talking about these larger DSOs and larger organizations, another interesting thing that, we keep talking to, again, with these 1,000 plus practices that we work with, probably 70 to 80% of them are standalone or one or two location practices, right? Maybe I'll call them private practices. They are not the large, HMOs or DSOs, right? But one challenge they run into, of course, is that how do you keep upgrading yourself? How do you keep up to date with the latest technology? How do you survive when you have, I would say, largely backed PE-backed hospital systems, right? Mm-hmm. So would love to learn from you, right? That how do you think these smaller practices can, survive in a market where a lot of these PE-backed hospital systems are now acquiring the private practices and bringing them into the, I would say, the brand wheel, right? Where you've got to sort of work with that brand.
Right. No, I hear what you're saying. It is a very difficult thing to look at. You see a bunch of practices around you being bought up. How can you remain independent? Right. So one of the toughest things about that is, this is going to sound so weird, but there is a need or a want to stay completely current But that is such a difficult thing to meet because technology changes over so fast. My high schooler is big into IT, and one of his personal frustrations is every time he invests money and buys his favorite computer, 5-6 months, it's outdated, right? That is no longer the top of technology anymore, and it's turning over so fast. And if you have a business, that can be a very frustrating point for you. I think one of the biggest things when we look at a business and we look at creative efficiencies, almost hardware is very much falling by the wayside, right?
Right.
Almost anymore, nobody invests in servers, or you always do everything now in the cloud, right?
Right.
So I think finding those little ways where you can decentralize yourself as far as a clinic the most, so that way you can be mobile. If your clinic was hit by a natural disaster tomorrow, could you still at least, you have to have a plan in your mind, right? Some basic things. Could you get communications around, right? Okay, so would you still have access to your financial and patient records? Well, if your EMR is in the cloud, yes, you probably would, more than likely, right? Would you be able to call your patients and let them know? Yes, you should be able to. Those kinds of things, thinking of that, versus having everything centralized to your office in terms of hardware, where if there was an office fire or an earthquake or a tornado or whatever, and your hardware was wiped out, and you just threw your hands up and you're like, I'm up a creek, what can I do? Thinking in that more decentralized mindset to say, okay, can we go home? Can I call my patient list? Can I do this? Those are just those kinds of forward-thinking mindsets where, you can be a business that can survive a downturn of a tough time. If the country went through a pandemic and you were forced to send everybody home, to what level could you maintain your operations?
Right.
How can you still keep, maybe, are you paired up with a good telehealth service, right? So that you could still see patients, at least enough to maintain through telehealth services. Telehealth it's not a cure-all. Can't do everything through telehealth, but maybe you can at least see some patients, right? And so just looking at those mindsets, but technology is a massive part of that, kind of breaking free of the wire, if you will, breaking free of being tied down, but rather still be able to keep your business going, even if you're not in the location,
Right.
So.
Absolutely. No, I think, I agree with you. And if you look at the data, when the pandemic first came and there was a lockdown, and then you had when the lockdown was lifted, and you were allowed to sort of run back your practice, the ones to bounce back the fastest were the DSOs. The ones to bounce back the fastest were teams, were practices that had larger teams that were managing technology, that were managing finance. So you had a CFO, etc. Right? So everybody was looking at specific problems and solving this problem, compared to a private practice where you just have the owner who's probably having to solve all these problems.
Right. And the best way to prepare for that, I shouldn't say prepare for that, but really just to be adaptable, right? To keep your business and your mindset and your workers adaptable is to invest in the technology ahead of time, so that, because the other big thing that I think healthcare as an industry has forgotten about is the patient experience, right? If your business was hit by a fire and you had to still figure out how you can see as many patients as you could this week, just to let them know, to try and get to the needs of those people that had really, critical illnesses and needed to see you desperately in the up and coming week. Part of that might be, what your telehealth platform look like, because you're still obligated to the laws, rules, regulations, and red tape. You're still, HIPAA is still, you need a HIPAA certified telehealth platform. You need this, you need that, right? You can't just pick up your iPhone and do FaceTime, because although it's a very easy platform, it's not completely secure.
Absolutely.
At least as far as healthcare regulations are concerned. So preparing for those kind of things and thinking ahead help you go from the what if situation or the oh my goodness situation to the we prepared for this. We can do this. We can be mobile, right? We don't have to completely shut down for the next week.
Absolutely. No, I completely agree with you. And I think sometimes we need to think of it ahead of need arises, right? So you've got to invest in it, because when the need arises, you cannot then run around finding what's the technology, which piece of the puzzle you need to sort of put in there to solve the problem. Got it. Great. No, I think this has definitely been, a great learning experience for me as well. One thing that I think one big takeaway for me is, and I think a lot of people don't really focus on this, right? You said that with time you've learned that now you need to start focusing on the macro events, right? You understand that, okay, if something has happened today, maybe if the fuel cost has gone up today, I may not see the impact today, but I'm going to see the impact 4 months down the line. So I need to start preparing today for those 4 months.
Absolutely. And again, touching on the fact that healthcare is built of people. If I own my own practice and let's say I was a physician and I employed 10 people in my practice, right? It's not just how does the rising cost of things affect you, but your business, because your business is mostly made up of your people, right? How does it affect them, right? Yeah. So how can you still get them to do their jobs if, for some reason, I don't know, there's a shortage on gas or something, right? Yeah. And thinking in that macro style mindset, thinking ahead, honestly, I think it empowers employees and really gives them a sense of safety. When around you, other businesses are scrambling, freaking out, not sure what to do, possibly even going to the extent of shutting down, stopping their business. You and your employees can still stay adaptable and can still carry on business. And when people have a sense of purpose, when you know that you have to come in because we have to see patients because we're providing we're providing healthcare to them, right? They need us, they don't. So when you're passionate about that mission like that, you get a sense out of being prepared for change.
Absolutely. I think that's like you said, right? When there is a feeling, there's a sense of purpose and everybody's aligned, then whatever changes are needed, it's easy to make those changes, right? So,
yeah, absolutely.
Got it. Great. David Paul, this has been super, super helpful, right? I mean, I have probably 100 more questions, but I understand we all have, our own, our own lives to sort of take care of as well outside of this podcast. And, I wouldn't want to keep you here longer, but just for our listeners, right? I mean, because I'm sure that the listeners are going to learn a lot from you. Potentially, there might be other leaders who are wanting to become CEOs or who are wanting to learn from other CEOs like you, right? What's the best way for listeners or leaders to sort of get in touch with you or reach you?
I would probably say right now the best way is through LinkedIn. Yeah, I'm on there, and people can reach out to me pretty freely on there. So until I get a little bit busier, at least in terms of people reaching out to me, I'd say that's the best way to get a hold of me.
Got it. Interesting. Sure. So if anybody wants to reach out to you, then maybe they should just reach out to you directly on LinkedIn, right?
Absolutely. Right now, that's the best way.
Got it. Great. All right. No, David Paul, this was super helpful, and thanks a lot, for being part of the show. I really enjoyed my conversation, and I'm sure that the audience is really going to love to hear what you had to share with them. So thanks a lot for being part of the show.
Anmol, thank you for having me on. It was great. I really enjoyed talking with you.
Yeah, likewise.
Thanks for listening to another episode of Emittr's podcast. Want to learn how you can reduce your new patient missed calls and grow your practice by 40% today? Take a look at emitrr.com.